Welcome back to Practice on Fire, where we talk about building the kind of dental career you actually dreamed of before dental school tried to beat it out of you. Today, we're tackling a topic that every dentist has dealt with at some point, and probably more than just once this week. You're diagnosing a broken tooth. It clearly needs a crown. You lay out all the visuals and logic, and the patient pauses and says, "Can you just fill it, doc?" Oh, that question.
Worst day of my life? What do you think?
It's loaded with anxiety, price sensitivity, and usually a little skepticism, like maybe you're trying to pad your numbers for the day. It's also exactly the kind of moment where we can either lose case acceptance or make it a win. That's why we've created a free guide that walks you through how to flip this script and present necessary treatment, like crowns, as good news, not bad news. And today, I want to break that down even further. By the way, check out the show notes for the link to that downloadable guide. So here's the deal. When patients hear crown, they hear expensive. They hear bad news. And in a world where people are trained to expect quick fixes and cheap copays, they immediately start looking for an alternative, a cheaper fix, a workaround. Enter the escape hatch, the filling. Now clinically, we all know that not every broken tooth is a candidate for a filling. That's not opinion, that's physics. You've got missing cusps, undermined structure, stress fractures, and yet the patient is hoping you can slap a little resin on it and call it a day. And they're not doing this because they're bad people. They just don't know. They don't understand why the crown is actually the better outcome. That's where our strategy comes in. We're not going to try to talk to them about the physics of this like they're engineers. What if instead of presenting the crown like it's bad news, we let them know what good news it is? Many times when teeth break, it's bad, pain, and they need to do surgery to extract it, and then many thousands of dollars to replace it with an implant. But here's the good news. With your tooth, we can fix it with just a crown. No extraction, no implant. That's a win. What happens when you say that? The patient exhales. They feel relief, gratitude even, because suddenly the crown isn't a punishment, it's a lucky break. Now, I shared this idea on YouTube a couple episodes back, and most of the feedback was positive, but there was one comment that really stood out. A viewer wrote, "So in this situation, a filling would work just fine, but you're upselling the crown because it's more profitable. I'm a capitalist, I get it, but it's scummy." Let's talk about that. To be clear, when a filling is appropriate, I recommend a filling. It's a conservative way to fix a minor problem. I have 4 fillings in my mouth that have lasted almost 40 years. But dentists also understand that fillings aren't always the answer when a big old chunk of the tooth is missing. This is exactly the kind of misunderstanding that patients and even some fellow dentists have. The assumption is that recommending a crown is a money grab. That if a filling could technically be done, it's the honest thing to do. But here's the thing. Dentistry isn't about what can technically be done if we want to practice hero-dontics. It's about what should be done to create the best outcome. Sure, we could pack a filling in there, but what happens if that filling fails, takes more of the tooth with it, and the patient ends up needing a root canal and crown, or worse, an implant? That's not conservative care. That's short-sighted care. We're not in the business of recommending unnecessary treatment. In fact, when case acceptance is strong for treatment that is appropriate, the pressure to push anything disappears. When your schedule is full of patients who trust you and say yes to appropriate treatment, you have the luxury of being more conservative, not less. You don't have to hunt for dentistry where there isn't any. And here's the part no one talks about. When your case acceptance is dialed in, your ethics get easier. You don't have to make assumptions based on what you think the patient can afford. You stop doing wallet biopsies. You stop giving one patient a full plan and another a patch job just because of how they show up dressed. You also stop trying to fill your schedule with 10 hygiene checks an hour just to scrape together some production. Instead, you're doing fewer exams, but they actually lead to meaningful treatment because your marketing brought in the right patients in the first place. Patients with broken teeth, missing teeth, embarrassment, pain. Patients who are motivated to say yes. That's the practice on fire strategy. Expand your clinical skills. Get serious about communication and case presentation. Build marketing that attracts real need, not free cleaning seekers who you must then convince to get fillings and crowns, even though they think everything is fine. So yeah, when someone accuses us of upselling crowns, it's clear they haven't seen how this actually plays out in real practices that follow our strategy. Now, let's switch gears and talk about something equally important: economic control. Specifically, how dentists are vulnerable to financial changes in ways most business owners aren't. On Dentaltown recently, there was a thread about rising supply costs, partly due to inflation, partly due to looming tariffs. The concern is real. Most businesses respond to increased costs by raising prices. That's just basic economics. But if you're a PPO-dependent dentist, you don't have that option. Your prices are fixed. You signed a contract. So when your lab costs go up, or your cost per glove doubles, or hygiene wages explode, guess who eats the difference? You do. That's what happened during COVID, and a lot of dentists are still trying to recover. Now we're staring down another round of cost increases, and the same problem still exists. You don't control your own pricing. And if you don't control your pricing, you don't control your business, period. That's why one of the central messages of this show is about breaking free from PPO dependency. Because when shocks hit, and they always do, you need to be able to adapt. But how do you do that when every other dentist in town still takes insurance? You stop trying to be the same. You stop marketing to everyone with a pulse. You stop being interchangeable.
Hell yeah!
One more story. A dentist posted in the same Dentaltown thread saying, and I quote, he's hoping for a recession so that hygiene wages will come down.
What you just said is one of the most insanely idiotic things I have ever heard.
Seriously, instead of changing his business model, instead of learning how to attract higher value patients, instead of developing new skills or improving his systems, his master plan is a recession so he can pay his hygienist $10 less per hour. Never mind that the demand for the procedures that are actually profitable in dentistry could plummet. That's what I call putting your focus on the wrong thing. This isn't just short-sighted, it's dangerous. If your profitability depends on economic pain and job losses across the country, your practice model is broken.
I'm not a smart man.
It's built on sand. And yet, that's how deeply entrenched some dentists are in the family dentistry playbook. They're clinging to it because it's what they know. And as things get harder, they double down, thinking, maybe if I just cut one more corner, it'll start working again. But here's a better way. Build a practice where you don't need a hygiene army, where you're not at the mercy of wage inflation, where your value isn't tied to how many fluoride trays you can supervise in a day. Let's wrap it up with this. Another dentist said he couldn't afford to give a raise to his hygienist because it would drop his income from $250K to $230K. That's almost a 20% cut, and yeah, that stings. But here's the mindset shift I want to challenge you with. What if your goal wasn't to protect $250K, but instead to play offense, improve your practice, and earn 3 times as much? Because if you're making 3 times more, giving your team raises becomes irrelevant to your personal goals. You can reward your team, build a stronger practice culture, and still save for retirement, fund your kids' education, take real vacations without compromise. That's what happens when you shift from reactive, insurance-driven dentistry to intentional, skill-based, value-focused private practice. If you're ready to stop playing small and start building something truly fulfilling and financially strong, then keep listening. We're just getting started. This is Practice on Fire. I'm Graham Dursley, Team POF out. Quick heads up, if you're loving the content, don't miss out on our free resources page. You'll find the link right in the show notes. First up is our escapehygenehell ebook. If today's episode hit home, this is your next step. It dives deep into everything we discuss on the podcast, how to build the tooth-fixing side of your practice, so the hygiene chair becomes just one item on your menu and not the featured main course. When you attract patients who already want treatment, case acceptance goes way up and you no longer need to do dozens of hygiene exams each day to diagnose enough dentistry. Next is our $1 Million Case Acceptance Conversation. In this guide, we show you how to deliver your treatment recommendations as good news, which makes patients feel better, say yes more often, and stop dragging their feet or looking for the escape hatch. And finally, if your schedule is packed but you're still getting last-minute no-shows and late cancellations, check out our no-show nullifier protocol. I built this system when I was booked out for weeks or months but still had gaping holes day to day. Dentists who've implemented it completely have seen a major drop in no-shows and a huge boost in schedule consistency. All right, team, your practice transformation starts now. Let's light this fire.